So I'll be a little bit like Billy, won't show too many results, and mainly talk and show pictures. But I thought I'd talk about some research ideas related to health complementarities and how these relate to demand for clean energy products. And here I'm talking primarily in lower-income countries, which will become evident as I go along. The main motivation here is that we know globally that there's a significant proportion of the global burden of disease, which is a preventable fraction of disease. Preventable in the sense that there are modifications to people's living environment that can reduce these diseases. And these solutions are pretty well known. So this pie chart shows the fraction of the environmental burden fraction of disease, which is about 21%. In 2004, it was about 25%. So that fraction has been declining slightly over time, but it's still significant. These are disability-adjusted life years, so it's an aggregate measure of mortality and morbidity. Now, this picture shows that global distribution of this environmental fraction of disease. And as we can see in this picture, most of these diseases are concentrated in sub-Saharan Africa and South and East Asia. If we look and unpack this environmental fraction of disease a little bit, one of the main culprits is household air pollution. And household air pollution is linked to a number of different conditions, environmental health-related conditions. And this pink part of the bar is the environmental fraction of that condition. And the rest of it is the overall total burden of disease. So air pollution is the leading environmental risk factor for global disease. And if we look specifically at different types of diseases that are caused here, 33% of respiratory illness is related to household air pollution. Other significant portions of lung cancer, ischemic heart disease, stroke, and then chronic obstructive pulmonary disease. So a number of different conditions. Now, another significant proportion of this is related to lack of access to safe water and sanitation. It's consistently among the 2 to 3 top environmental risk factors for global disease, depending on which country we're looking at. And here we're talking primarily about waterborne illness. 34% of these diarrheal diseases, for example, are linked to poor drinking water quality. And there are a variety of other conditions that are related to poor water and sanitation. OK, so the main question here that I'm interested in talking about with you is that we've got these diseases, and they tend to be taken on in sort of a siloed approach. The donor and policy community thinks these as very separate problems: household air pollution, poor water, and sanitation. In some sense, this is very logical. It makes these problems manageable. Different agencies or community actors, institutions could be involved in reducing each of these conditions, so they may not work together. Resources are fairly limited. Multiple interventions tend to be more expensive, and they're also complicated to manage. So if I'm designing something that is trying to address both water and sanitation problems and air pollution problems, that becomes a very complicated intervention. And it's also very hard to make comparisons across these incommensurable outcomes. So how do we weight a diarrheal disease case versus some kind of respiratory illness case? And the global health community has ways of thinking about that. Economists have ways of thinking about that. But these kinds of aggregated comparable measures are controversial, to say the least. OK, so there are 3 potential problems with this separation that I see. And that's kind of the subject of this research. One is that there may be complementarities across interventions. So if you improve conditions in one domain, you may actually make people better off in another domain, or you may increase their demand for improvements in another domain, so that you get sort of nice synergies between these. There could be substitution across interventions if people see one investment as depleting resources that could be used for another. Or there may just be underinvestment due to multiple risks that people just don't see value in reducing any kind of disease risk because there's another disease risk right around the corner lurking to get them. So the research question here is which of these explanations is most relevant to observed behavior. And I'll talk about sort of 4 basic projects that I'm working on in this domain very briefly. One is looking at drivers of demand for improved cook stoves, and we see that there are correlations with risk-reducing behaviors. Another is that even within one domain, if you invest in better drinking water quality at the source, people may cut back on treatment at home. Third one is sanitation promotion campaign, which was a randomized campaign, and we're going back and now seeing if demand is different for another technology, which is improved cook stoves. So have done some auctions for that to see if there's some complementarity or substitution there. And then finally, that looking at sort of co-reductions in these disease risks and seeing if what people tell us they're willing to pay for one impacts what they're willing to pay for another in surveys, but also then testing this in the field. And Faraz has been involved in that work. So that's it. This is all part of a larger sort of research program on sustainable energy transitions, and you can visit our website for more information.
Hi, my name is Christine Folch. I'm a cultural anthropologist. This is my first year here at Duke, so I feel like I'm learning the culture of the natives and the locals. And part of that is today, because I think this is a very cross-disciplinary room, and so our different disciplinary conventions of presenting are front and center. We write everything out. So that is, I'm going to read you something that I actually wrote. So I want to thank the presenters for the chance to speak here. I research really large-scale renewable energy resources in South America. But I'm not going to get into the details of my work on energy infrastructure, both legal, political, and built environment. Instead, what I want to do is I want to actually focus a bit more on some of the questions raised by the findings. So today's talk was entitled, and is still entitled, Sovereignty and Sustainability, Balancing Competing Values in Renewable Energy. I'm going to talk about things that I think are, thank you, problems that are answerable only in cross-disciplinary contexts. My basic question is this. How are the high priority values of sustainability and sovereignty impacted by ecological crisis, limited natural resources, anthropogenic climate change, and how does all of this intersect with energy? So sustainability. Here's the problem I see in a nutshell. Sustainability is not just, or perhaps even primarily, an engineering puzzle to be solved. Sustainability is a socio-political / cultural question. When we speak of it as a desired goal, we often leave unspoken very important questions. We jump to the how without addressing the what, or the who, or the why. Sustainability of what? Economic growth, global temperatures, diversity of species. For whom? For the nearly 3 billion people who live on less than $2 a day? For middle-class citizens of the global north? For diatoms? And why? What's the question that it's the answer to? I don't think we need to, or indeed confine an overarching global definition of sustainability. This needs to be done on a more local or regional level, but I think we can anticipate increased conflicts when different definitions of sustainability come into contact with one another. And so there are ethical and metaphysical questions in a loop with physics and engineering. Second, sovereignty. I think it might be useful to restate the obvious. And I know that sovereignty hasn't come up yet today, but countries go to war to defend their sovereignty. And this actually plays into issues with electricity. So I'm going to talk really quickly about hydrocarbons, even though I'm about renewable energy. There's a social historian named Timothy Mitchell who has worked extensively on the history of fossil fuels in the Middle East. That's his area of interest. In his book, Carbon Democracy, what he does is he traces extractive techniques and the geographic distribution of coal and petroleum to see how it impacts politics and economics. And so what he found, for example, in coal mining is that because of how it's mined and because of how it's transported in terms of railways, coal leads to a powerful national labor movement in the 19th and early 20th century. But with petroleum, which is extracted with tech-heavy equipment, and which can be transported in barges, which can totally change where they're going to go mid-route, political power moves to cosmopolitan and economic elites. So what I like about this is the focus on geography, extractive techniques, and transportation. So to wrap up my presentation, I want to raise a few points on renewable energy. One of the stated attractive qualities of renewable energy, which is debatable how we want to define it, wind, solar, tidal, geothermal, hydroelectric, is its sustainability. But the definitional questions I raised earlier are still problems here. And two, renewable energy requires built infrastructural investments that are like coal in terms of transportation. There are permanent high-tension lines that connect sites of production or places of production or regions of production to consumption, and that are petroleum-like in terms of high technology involvement in terms of extraction. And this is where sovereignty comes in. Those places of high untapped renewable energy potential are often not the places of high demand. For example, we hear that harnessing the solar power of the Sahara can power all of Europe and Africa, and even the world. Yet, given the political instability of the region, and I hope I'm not overly cynical here, but it's hard for me to imagine Europe and sub-Saharan Africa putting all of their eggs, or most of their eggs, in that basket. And in the region that I know best, the South American rivers that have the greatest hydroelectric potential, and this is something that Ildo mentioned earlier, they're transboundary rivers, or they're rivers that have global significance, like the Amazon. And so I'm sort of trying to bring in a question of values and decision-making as actually part of the process of things that we need to consider as we're thinking about energy solutions and policy. So thank you.
Christine's very lovely way of saying that we have all these different disciplines whose presentation styles are coming out and sort of evoking the ethos of their profession. I'm a lawyer. We don't do presentations. We do oral arguments. So that's going to be the style of my 5-minute sketch. So my work is at the Nicholas Institute. I direct the state policy program. And what that means is I'm really interested in what the sub-federal actors are doing in response to or in the absence of federal action. And one of the most timely places that that's kind of playing out is in the shale gas revolution and in the governance structure around hydraulic fracturing, which for folks who are in the industry means everything from exploration, or means only the actual hydraulic fracturing of the horizontal well, and to the general public means everything from the exploration to the disposal of the waste at the other end. And since I work with both constituencies, if I slip up, you should just assume that I mean the whole thing if I say hydraulic fracturing. So one of the early debates in this was whether or not federal actors, should the federal government be the primary regulator for the activities and the impacts, the environmental and public health impacts that are associated with hydraulic fracturing. And that was resolved in about 2007 with the Energy Policy Act, where there were a number of exemptions that were granted to the industry. It really devolved then to the states to set the regulatory frame, to understand what those risks were, and to appropriately enforce and set the standards. When that happened, the locus of the debate shifted to the states. In the past, so what are we at? Past 5 years, really, we've had quite a level of regulatory innovation that's happened with the states. States have gotten their regulatory programs up to date. They're continually evolving. They're really working. And with that shift, the debate shifts down to the local governments. So what authority should local governments have in regulating and understanding the impacts? And this makes a lot of sense if you think about what hydraulic fracturing is, what shale gas, oil, and gas exploration is. It's an industrial site, about 3 to 5 acres, that's in the middle of the country, or in the middle of a rural area, or it's in the downtown if you're in Fort Worth, or it's across from a school, or it's across from somebody's home. And those are the folks that are looking at what the impacts are likely to be. So the local governments are very concerned. They're experiencing a lot of costs. They're concerned about how are they going to get paid for that. How do they protect the culture of their community? And they're setting regulations. And so one of the interesting places that this has played out in recent times is in Texas. That is the heart and soul of oil and gas in the country. It's a great place to study this kind of industry. And this is the legal part. This is the one thing that you need to know if you're a lawyer. Texas is a home rule state. So what that means is that if you live in Texas and you've gathered up 5,000 of your closest friends and you've created a small city, you have the ability to set your own destiny. You are a government. You can tax, you can do ordinances as long as it's not in violation of the federal or in direct violation of state law. So what you see when you look at ordinances across Texas municipalities is a high degree of heterogeneity. So they've made decisions based on their community whether an oil rig should be 300 feet from a house or it should be 1,500 feet, whether something could be in a floodplain or not, whether you keep that out of the floodplain. What kind of testing might you do? What are the standards both at the surface and the subsurface for oil and gas exploration? And then Denton happened. So Denton, there's a really lovely backstory that won't fit in my 5 minutes, but you can grab me after during drinks to talk. Denton, for a variety of reasons, passed a ban and said, we are not going to have oil and gas in our jurisdiction. The legislative response was swift and final. There shall be no banning oil and gas exploration within local government jurisdictions. The legislation, again from a lawyer's perspective, is really interesting. It says you can't ban it, but you can continue to do all the other regulations that you're used to doing as a local government. You can keep it away from your schools or not. You can decide what kind of enforcement scheme or what kind of permitting schedule you might have. 15 seconds, okay. Storytelling takes longer than 5 minutes. So the legislation, when you talk to advocates for the local governments, they say this is a radical change from Texas's home rule. This is dramatically different from how we've done it in the past. If you talk to members of the General Assembly, they say all we've done is codify what has always been true. You've always been able to set your own regulations within the limit of what the state legislation has done. And I'm taking more than my 15 seconds, but I will wrap up in 8 sentences. So this research is developing a database of all of the local government's ordinances that have been passed to regulate oil and gas in Texas in unconventional plays. It's analyzing the state structure and looking for where, up until where House Bill 40 was passed, local governments did do something. Were they only on the surface? Did they actually, how many of them actually looked at subsurface? What were the regulatory frames, and was there really a conflict other than banning between the local governments and the state? I should point out in my closing that this is in very close collaboration and deep partnership with Chris Timmons, who's in the economics department, and he would be able to speak to all of the economists in the room. But our goal is to understand what the source, how much heterogeneity is there really, and if we can start to chip away at this question about what's the right jurisdiction for governance.